Hi, welcome to the COVID-19 Lake Norman, North Mecklenburg briefing call. Today is Thursday, March 19th. My name is John Bradford. I am a small business owner right here in North Mecklenburg. I'm also a former member of the North Carolina House of Representatives. I am your briefing call moderator. The purpose of this call is to bring together healthcare experts, governmental officials, and business leaders to provide regular COVID-19 updates to support the Lake Norman community during the outbreak. As you can see on the slide in front of you, the President's office has an initiative called 15 Days to Slow the Spread. If you feel sick, stay home. If your children are sick, please keep them at home. Do not send them to school and contact your medical provider. If someone in your household has tested positive, please keep the entire household at home. Do not go to work, do not go to school, and contact your medical provider. If you're an older person, please stay at home and away from other people. And if you're a person with a serious underlying health condition that can put you at an increased risk, so please stay at home and away from other people. On this slide, you see you have the cdc.gov site as well as coronavirus.gov. On the next slide here, you see the flattening of the curve. You can see the blue curve is what we're trying to achieve. The orange curve is an outbreak without protective measures. So if we continue to be smart, we can have a curve that's flattened, and we want to emulate the blue curve. One thing I want to leave the impression with all of you is that a majority of the infections are still mild. About 80% are considered mild, 13% are severe, and about 4% are critical. And this is a study from about 45,000 patients. This slide is talking about cleaning and disinfecting. Just a friendly reminder, if you're at gas pumps, use a napkin before you get gas, and you can make your own disinfectants at home. You can take 4 teaspoons of bleach per quart of water. Do not mix any ammonia products with that, but you can also use 5 tablespoons or a 1/3 cup of bleach per gallon of water and make your own disinfectant at home. Just an update on the state of affairs in North Carolina. We're still under a state of emergency, which started on March the 10th. K through 12 schools are still closed. Gatherings of 100 or more are banned. The North Carolina Department of Health and Human Services recommends no gatherings of greater than 50 people. Bars and restaurants were ordered to close their dining rooms. This does also include outdoor patios. I heard some rumors that outdoor patios could be open. That is not true. I got clarity this morning. But takeout and delivery and curbside remains allowable and permissible. You can call 211, which is United Way's hotline on your phone. They will not give you any medical advice, but they can be a resource for COVID-19 and connect you with other resources in your community. And North Carolina Emergency Management, if you text COVID-NC to 898-211, you can get regular updates. And of course, you still see right here on the slide the 1-866 number for the North Carolina Department of Health and Human Services hotline. By the numbers, on our briefing call on Tuesday, there were 40 cases in North Carolina. There are now 97. There have been 7,000 U.S. cases. That's up from 3,500 on our last briefing, and there have been 97 deaths in the U.S. There have been 0 deaths in North Carolina as of today. So there have still been no deaths in North Carolina. This map here shows you all 100 counties. We have 22 counties that do have positive test results. And if you remember from our other briefing call, Mecklenburg was a dark blue, but now Durham is the darker blue. So Durham is more of a hot spot than other counties. But you can see a lot of the counties are starting to turn the same color blue. So this thing is progressing throughout counties. Now I'm going to introduce and turn it over to United States Senator Thom Tillis, who has joined us today. He was also former Speaker of the North Carolina House. Thom has joined our call to just give us a quick update on what's going on in Washington. Thom, thanks for being with us today. The phone's yours.
Thank you, John, and thanks to my friends and neighbors back in the Lake Norman area. Probably 3 things that I'd like to talk about. The first is what action Congress is taking. The first act that we took was the $8 billion appropriations bill, supplemental appropriations bill, to basically fund the federal and state agencies as they prepare for the healthcare response. We're working with Governor Cooper. I've spoken with him this week. I participate in all their task force calls to figure out if there are any hurdles to that money getting to the states, then we'll remove them. And so far, things are going well there. The next thing that we did was a bill that we passed yesterday, which was what we call the phase 2 response. That was to give people who are getting sick, they may have to be home because their daycare or school closings have presented challenges for child care or other circumstances, maybe caring for elderly family member. And that bill was sent to the president's desk last night. He signed it so that we can start providing some relief to the individuals. The bill that we're working on late last night and early this morning, and we hope to have text and get it on the floor by either tonight or tomorrow, is to now backstop the businesses who are affected, who may be providing some support to their employees that are being furloughed or potentially having to go on unemployment. And we're getting broad-based support here. We're really working on a bipartisan basis, and we're going to get that out. The reason we're referring to these as phases is that we expect that we will have other ones, like the healthcare system is learning and making changes. Governors are learning and making changes as they go. I don't think that we should criticize them for that. I think we should compliment them for being flexible and work on the best information. We will most likely have a phase 4, phase 5, possibly phase 6 reaction to economic stability. We're also working with the VA. I just got off a conference call with the director of the VA. They're doing a very good job. In fact, the private sector can learn a lot from what they're doing to provide capacity. So that's an update on the legislative actions. Here's the one thing that we have to be very, very careful, and it's very important to communicate into our communities. We have to strike a balance. On the one hand, we do not want the population to get exposed. On the other hand, we need as many healthy people as are able to go to work. If I was just on the phone with a very large pork processing operator, and if we have people afraid to go to work and they're involved in the food supply chain, that could present a problem. If we have people in grocery stores afraid to go to work and they're healthy, they don't exhibit symptoms, and they're healthy, we need the people in our communities to go to work. I've got a daughter who works down at Levine Children's Hospital. She's got a 2-year-old at home. She's got another baby on the way in August. She's a nurse, and she's showing up for work. And she's trying to do everything she can to have protective gear, but we have got to make sure that we send the message that if we start losing that productivity in the community, whether it's the food supply chain, healthcare resources, we're getting reports that some folks are not showing up to healthcare offices. We can't provide care. We have to really strike that balance and implement processes that make sense. Half of my staff are working remotely, and they will be for 14 days. We're checking to see their health, and then we'll rotate and have half my staff go home, and the other half will come back in. We've got to make sure we're doing everything we can to have people contributing at every level possible, because the supply chain, the food supply chain, the basic services are critically important to keep moving while we deal with the population. That's the last thing I'll leave you with. We're under 200 deaths across the United States. There have been no deaths of anyone under the age of 40. The deaths that we've observed in the age 50 and over category almost invariably had chronic underlying health conditions. So we have to send the message that you may get sick, and when you're sick, you need to be quarantined and deal with it, but you're most likely going to be doing that in the privacy of your own home. And it's important that you do that so that we can have the capacity in the hospitals to deal with those who need ventilators and who need more critical care. So the more we can communicate that through our email list to motivate people to work, do their part, and make sure that we have the capacity to deal with those who are going to be most at risk, we'll be helping the situation back in North Carolina and the Lake Norman area. So that's all I have, John. Thank you for allowing me to be on the call. Everybody should have my contact information. Certainly get in touch with my office if there's anything you're dealing with that we can help out with.
That sounds good. Hey, thank you for what you're doing for the country in North Carolina. We appreciate you, Thom. Have a great day.
Thank you.
Moving on. Congressman Greg Murphy, who was on our last briefing call, he actually has a conflict, so he's on a different call right now, so he's unable to be here today. I am going to introduce, we do have another medical doctor, Dr. Jack Faircloth, who works in Huntersville. He works for the Holston Medical Group. They're a large provider. They have 60 locations, 225 providers, over 1,000 employees, and they see well over 60,000 patients a month. He's right here in North Mecklenburg. Dr. Faircloth, we would love to hear an update from you from a local medical provider and what's going on there. So I'll turn this over to you.
Okay, thank you, John. Privileged to do this. I just want to say first, I echo your comments, John, as well as Senator Tillis. They were excellent. I won't belabor those points. I'll get right to it. My message for North Mecklenburg County is that it's really very simple. The novel coronavirus is here. We are, as a community, and we will be safe at a 99+% rate. We have testing, but it's very limited as of today. It increases, the testing capability increases by 1,000 on a day-to-day basis, and we are expecting full testing capability within a matter of days to a week, and not months, nothing longer than days to a week. We have also this other message that what can we do as a community? What do doctors ask you guys to do and my own family to do to help us get through this? Those are the details. We've seen several positives. We have them in Huntersville, Mooresville, Denver. The real number is higher, and we know that's true because of limited testing kits. We're rationing those to the sickest, the most vulnerable. Providers are safe as well. We have enough personal protection equipment. We have to go to work and to be here. We've cleared our schedules. The CDC has ordered all elective ambulatory visits to be canceled, and you've seen closure of many specialty offices. So we have primary care, we have urgent care, we have ER, we still have plenty of hospital capacity. Our hospital systems deserve a huge pat on the back. We have two in this area, Atrium Health and we have Novant Health. Both have multiple testing sites as of today. Both have their own 24-hour numbers that are free to call. You can speak to a live RN. I'll give that number at the end. And both have drive-through testing plans. Some have it already, but both healthcare systems will be doing things remotely and safely. And once the testing capacity increases, we will have the ability to test whoever wants to test, and these restrictions on testing will be going away soon. So, what do we ask the patient to do if they suspect it? The biggest tool the patient has in the community against the coronavirus evaluation piece, not prevention, but evaluation, is a thermometer. If they believe they have a fever and check their temperature, and we're using the national guidelines of 100.4, we would like those patients to contact us if they have a fever and one of the following two symptoms: cough or shortness of breath. From there, you still don't definitely have coronavirus. You may, often more cases than not, get tested. But if there's other factors and you have fever of 100.4 and cough or shortness of breath, we're asking for a phone call, preferably to your local doctor, or a call to one of these two numbers if you don't have a physician, and we will walk you through it with a live, well-trained, well-staffed clinic that will see you that same day. From that point, I'll keep it general. I mentioned we have these two numbers. Let me give that to people. Atrium has 3 testing sites right now. They're at the airport, they're in Matthews, and they're in Concord. Their phone number to access any of those or to just talk about this virus is 704-468-8878. And that, again, is a COVID-only dedicated line they've set up for our community. Novant has an equally very, very helpful free number, 1-877-966-8268. They have testing in Huntersville, as of today, they have testing in Matthews as of today. They are planning on an unknown amount of increase. Atrium has a more robust follow-through system. They have what's called a hospital in-home system set up and waiting for patients. So the fear of not having a hospital bed is not real because of what Senator Tillis mentioned. For the majority, and 99 plus, 98 in the worst cases around the world, but 99 plus for us, percentage, this will be an at-home virus that you shelter in place, and you get what's called hospital and home, if you would like it, through Atrium Health and possibly through Novant once they're up and running. Hospital at home is multi-specialty staffed panel that will touch base virtually through telemedicine with you at home, all the way through the illness, through the arc of care that you need. It will also include direct admission to an ICU, so you can bypass the ER. So this is a wonderful first time ever in the history of medicine that healthcare systems have had such capability waiting. Lastly, I just want to summarize. It is here. The coronavirus is here. We feel the majority of our community are safe and will be safe. We need to be judicious and prudent with our testing as of today, but that doesn't mean we can't test everybody in a matter of days. We're expecting the increase. For example, South Korea tests 20,000 a day. They had a head start on us. The U.S. has tested less than 40,000 total since this started. Technology's there. It's a matter of shipping and logistics and supplies. So we're expecting it to change. What do we ask of our community? I'll end with this. We have valuable tools. We have soap and water. We have thermometers. We have social distancing. We also want them to just remember their faith in God and their love for their fellow man, because that's what's going to keep us adhering to these inconvenient guidelines, but they are very, very important. Thank you.
Thank you so much, Dr. Faircloth, for that very thorough update. I'm now going to introduce Mecklenburg County Commissioner Pat Cotham, who's going to give us an update on the county. Pat, I think you're on the line. The telephone's yours.
All right, thank you, and thank you for organizing this phone call. I don't want to repeat anything that's already been said. I just wanted to give you an update on what I have learned, and really since early this morning or late last night. One thing I did want to clarify, our health director, Gibby Harris, the other day at our board meeting made a comment about possibly the directive of shelter in place. And I want to clarify that she does not have the authority on her own to do that. That would not happen unless, first of all, if the Board of County Commissioners supported that, but it would be in heavy consultation with the state and with our local hospital systems. If that were to happen, it would likely come from the governor, and likely we would not get any advance notice of that. So I have had a lot of phone calls about this, so I did want to just say again that that cannot be decided by the health director just for Mecklenburg County. As I just want to update that, as far as I know, in Mecklenburg County, we have 30 cases confirmed. And that's not a surprise because they're doing more testing. So the more testing, we're going to get more cases. A few things that are new or that I want you to be aware of. The county is not working independently. We are working in collaboration with the hospitals, with the city of Charlotte, with the fire departments and medic and the towns in the hospitals, and they have what they call, and they keep calling it an EOC, which means Emergency Operations Center, and that is headquartered at the Police and Fire Training Complex on Shopton Road. So that's kind of like the war room, and they are working on I've had a lot of calls about people wanting to volunteer, and they are working on a website. It is not up now, but I expect it to be up in the next 24 hours, and it's called www.charlotteresponse.com. charlotteresponse.com. Now, the first thing I complained about is, why did it say Charlotte when we have 6 towns? And the manager was aware of that and said it does include the whole county, but I wasn't happy with the name, and I issued my complaint about that. But again, it's called charlotteresponse.com. And we have been trying to work with the Foundation for the Carolinas to raise extra money. And so at the meeting, we had confirmed that we have raised over $5 million. And the county included in that $5 million is 1.3 from the county. We did designate, and that money will be dispersed by the United Way. And the United Way will not disperse that money to individuals, but to nonprofits working with individuals. So we can maintain some accountability on that. And some of the programs that are happening do not seem to be helping our micro businesses. We often use the term small business, but in reality, we have many small businesses that are really micro businesses. And so the federal and the state programs, like with SBA, don't seem to include micro businesses. So these are the catering companies, the cleaning companies, maybe a hair salon or a barbershop, maybe something that has like 10 to 15 employees or less. I had my own small business for 10 years, and I had like 5 employees. So it was an executive search firm. I would have been included in that micro businesses. So I am hearing from them mainly through the 3 minority chambers, and they're kind of feeling left out. So I have asked our county manager to keep that on her radar. And I know in North Mecklenburg, there are certainly a lot of these micro businesses. Maybe they could be retail where it's a small operation. And they also said, like, Duke Energy was, not cutting off electricity for people, for homes, but that wasn't including any small businesses. And they're trying very hard to keep their employees working. So I just want to bring that to your attention. I learned today that the governor's office just announced calling of 211 to help people get general information about the virus. Seems like we're having a problem with people calling 911 just for general questions. The governor's office just also announced a website that is www.nc211.org. Again, www.nc211.org. Or people can text COVID-NC, again, COVID-NC, to 898-211, and then they will receive general, likely daily updates. Again, that text is COVID-NC, that's all together, to 898-211. So that's all I have.
Thank you, Pat.
From the county. I hope that's of some help to some people.
No, thank you very, very much. Thank you, Pat. That's helpful, and welcome to our briefing call. I just got a notice from CMS board member Rhonda Lennon that she has to hop into a meeting, so I'm going to quickly go down to Rhonda. Rhonda, we're going to put you in the queue right now, so can you give us a quick update before your 1 o'clock board meeting?
I can, thank you. And it's not a board meeting, it's just an update.
I'm sorry.
Update. So yeah, that's okay, because otherwise we'd have to have noticed it. But anyway, so I just want to say we're doing a great job with the meal program. We served 19,000 meals the first day we rolled it out, which was Tuesday. that's remarkable, in that there was, number one, that much need, that we got it done that quickly. Kids were literally out of school one day before we were able to restart the meal program. So I want to tell people, if they need help with the meal program, they can call 980-343-6041, and we can arrange for delivery. We've got a lot of community partners that are picking up quantities of meals and taking them to certain neighborhoods that are a little farther away, or where there's a population that doesn't have transportation. So this meal, the 19,000 is increasing astronomically each day. And like Senator Tillis said, we need to keep people healthy. Our cafeteria workers are just valiant people in the trenches out there for us right now, working within special precautions to get these meals out so that people can do the grab and go pick up. And we just salute those cafeteria workers for keeping this valuable service going. In addition, I just tell people, direct them to their CMS homepage for links for everything. This week, as you know, we rolled out online learning. This week is just kind of supplemental and kind of getting to know things, but kids are reporting and teachers are posting amazing things in social media. We've got principals from our local schools. Grand Oak Elementary principal has a story time with Mr. G tomorrow morning, and you can log into Facebook and do a Facebook Live, listen to the reading time. Teachers are doing lessons with kids on Google Hangout and a lot of other neat platforms that are going on. So there is learning going on, and there is just incredible support from the teachers and staff at our schools right now. They've been amazing, and we're just going to keep the ball moving forward. This is an ever-changing situation. We don't know how long this is going to last.
Yeah, thank you, Rhonda, for being a part of this briefing panel, and we thank you for all your hard work, and we really appreciate all those frontline workers, like the cafeteria workers. I mean, they're making it happen, and please extend our appreciation. So thank you, and I know you've got a meeting, so I'm now going to go to Cornelius Mayor Woody Washam. Woody, please let us know what's going on in Cornelius.
Thank you, John. I'll try to shorten this, but I want everybody to know that effective March the 20th, tomorrow, Friday, March the 20th, we're closing all of our offices to the public. The lobby and the police station, the lobby at the police station will remain open, and our teams will remain in the offices working. Some will be working from home, but we will be able to respond. We're also working to provide the number of first responders that need child care out there to Mecklenburg County, and there's hopes that we can establish a facility here in North Mecklenburg. Also, as of this morning, out of the 30 cases that are confirmed in Mecklenburg County, fortunately, we do not have any known cases in Cornelius. We are trying to push the message out through our communications department that 40% of those hospitalized are now under the high-risk age. So we're working to make sure folks realize that. The high-risk age is certainly, the death factors are higher, but all folks are susceptible to getting this, and we want folks to understand that those that are hospitalized, that's increasing. Also, our fire department, the Cornelius Fire Department, is working closely with Charlotte Mecklenburg. Emergency management has been doing that for about 2 weeks now, and this is all to prepare for this COVID-19 attack that we seem to be under right now. So that will do it for Cornelius.
Thank you, Mayor. Appreciate your time. I don't know, is anyone on from the town of Davidson? Anyone from the town of Davidson? Okay, if not, moving on to the town of Huntersville, we have Mayor John Aneralla on the line. John, if you give us an update for Huntersville, that'd be appreciated.
Sure. I don't have too much to add. Similarly to what Mr. Washam said, the town has closed all its facilities to the public. We encourage you to either email us at townhall@huntersville.org or call 704-875-6541. The parks and greenways are open, so get out and enjoy the fresh air and the beautiful weather we're having. Our fire station, they're working every day, and our police as well, but you can't come and visit. But I'm sure dropping off something would be greatly appreciated. And then just to reiterate, there are testing centers in the North Meck area. I'll give you the addresses: 16525 Hollycrest Lane in Huntersville, 9121 Sam Fur Road in Huntersville, and 19485 in Old Jatan, and those are Novant, in addition to what the previous doctor stated. I went by one of them today. There were 3 individuals getting tested in the drive-through. I was very orderly, and you know, if you really feel like you got that temperature and you got the cough, please go, but do not go if you're healthy, because I'm sure it's going to get busier and busier as there are more tests out there. The final thing I would say is for small business assistance, you can go to governor.nc.gov and look to see if you qualify for any of those programs that the Small Business Administration is rolling out. And that's all I have.
Thank you, Mayor, very, very much for your update. We appreciate you. Now we're going to go to Bill Russell, the CEO of Lake Norman Chamber of Commerce. Bill, the microphone's yours.
Been busy here too, John. As we discussed a couple of days ago, we've rolled out Feed Lake Norman. If you go to Lake Norman Chamber of Commerce website at lakenormanchamber.org, you will see a complete listing of all of the Chamber's restaurant members, their websites, their phone numbers that are doing curbside, they're doing pickup and delivery. So you can go there for that complete list. Also at the bottom is a comprehensive list of all of our restaurants in Cornelius, Davidson, and Huntersville that's been compiled by Visit Lake Norman. Both of our lists are being updated on a regular basis. So if you're a restaurant and you've been left out, let us know and we'll add you to the list. That's gone out to the Chamber's membership. It's also on our website. We are now focusing also on our Shop Lake Norman. We have a number of retailers in our area. We want to try to support them to the best of our ability. So we've reached out today. If you are a retailer, what we encourage you to do is create a gift card or a gift certificate that a consumer can buy online or by phone without ever coming into the shop. Perhaps create an incentive so if somebody buys a $50 gift certificate, maybe they get 10% off. If they buy a $100 gift certificate or gift card, they get 20% off. So some type of incentive, but that in the meantime gives an instantaneous cash flow of revenue to that retailer's business, and it creates a savings for the consumer. So we're hoping that our area retailers will take part in that. Again, we'll be creating a Shop Lake Norman page that mirrors our Feed Lake Norman page. I won't go into the small business assistance since Mayor Aneralla and Senator Tillis has already touched on that. I will say though, John, I have been amazed at the outpouring of support from Chamber of Commerce members and folks who have emailed and called me to say what we're doing in terms of Visit Lake Norman, this Chamber of Commerce, supporting businesses, and they're out there doing the same thing. They're utilizing these lists, they're shopping our stores, they're supporting our restaurants. It's critical that we keep these businesses in business. So again, I want to thank everybody that's working to support each other. If there were any region or community in the world that you'd want to live in, work in, and visit, it is Lake Norman, because the people here support each other. And the message is we're going to get through it. We're going to move past this. We'll look back on it. And again, thank you for everybody for supporting each other.
Yeah, thank you, Bill, for that update. Much appreciated. Thank you for all what you're doing for all businesses, both micro, small, and large in our community. I did want to just comment that Jill Swain with the Huntersville Regional Chambers was not available to attend today's call, but she did report to me that she believes her members are working hard to help other members. This actually concludes today's briefing. We will be doing another briefing on Monday, March 23rd, which will, obviously get us through the weekend. Today's call went a little longer than usual, 45 minutes, but these are obviously life and death issues, and so it's very important. Appreciate everyone tuning in. And again, my name is John Bradford, your briefing call moderator. Please stay safe, please stay healthy, and we look forward to doing this again on Monday, March 23rd. Thank you.